My name's Anton Rieselback. I'm a program officer at the Juneau Economic Development Council, specializing in research related to policy and economic impact. So we were mostly interested in the changes that are being made to the health insurance marketplace, that is insurance purchased through the federal exchange in Alaska, healthcare.gov. We're interested in that because one of the main provisions of the most recent budget reconciliation bill, H.R. 1, is the elimination, or rather the expiration, of the enhanced premium tax credits. And these basically were a boost to the Affordable Care Act subsidies that were initially put in place in the early 2000s, and they were signed into law in 2020 as part of the American Rescue Plan Act. Basically what these do is offer greater subsidies for those already receiving them, and it also expands eligibility for premium tax credits to individuals above 400% of the federal poverty line. So previously, that cutoff, 400% above the federal poverty line, was referred to as the subsidy cliff, because if you make even 401% above that line, you're no longer eligible whatsoever for any sort of subsidies. And then you're stuck paying the full cost of these health insurance premiums that you're purchasing on the marketplace, which can often be over $1,000 a month before any deductible or out-of-pocket max kicks in. So they really make health insurance affordable for a lot of individuals, and with the expiration of these at the end of the year, barring any sort of congressional intervention, we're going to see a whole lot of people that are either uninsured because they can't afford the new premiums, or are severely encumbered by the, economically. So it's anyone who doesn't have insurance through either their employer, some other federal program like Medicare or Medicaid. So often these are people who are self-employed, are business owners. It might be someone who retired early and isn't yet eligible, for retirement benefits. But in Juneau, we see about 1,300, a little over 1,300 individuals enrolled in 2025, based on most recent Center for Medicaid and Medicare Services data, which might be a slight overestimate because that doesn't take into account the number of people who actually pay their premiums. But it is a good number to estimate. About maybe a little over 1/30 of the population in Juneau is affected, but nationwide, this affects millions and millions of individuals. So with the expiration of these enhanced premium tax credits, there's going to be a significant change in affordability of health insurance for millions of Americans and tens of thousands of Alaskans. Juneau population is about 31,500, so ballpark, about 1/30 of the population, a little bit over 1/30 of the population is enrolled. We do see about 300 individuals who are above 400% of the federal poverty line enrolled in Juneau. So for individuals within that group, they're going to see the most significant effects. Yeah, it is a majority of individuals are taking advantage of the tax credit, especially with the enhanced premium tax credits, which expanded eligibility for individuals, making 400, 450, 500, even 600% above the federal poverty line. Essentially the repeal of these tax credits is going to take away a lot of people's health insurance, or rather their ability to pay for their health insurance premiums, which will in turn lead to less health insurance enrollment overall. Well, we have a lot of concerns about what the economic impacts of the expiration of these premium tax credits might have at JEDC. Obviously, Alaska healthcare costs are already high. People having to fly to different areas to receive care, premiums being higher than the rest of the U.S. There are a lot of factors kind of contributing to that, but we're used to seeing really high healthcare costs in Alaska. So we are concerned about the overall economic ramifications that the expiration of these tax credits is going to have. Specifically, on the local healthcare system, for example. I know that Bartlett Regional Hospital has expressed some concern about the expiration of these tax credits because that's going to lead to less insured individuals, which means less revenue for the hospital. But it also means that, if people aren't insured, that means they're probably not seeing primary care physicians. And typically uninsured individuals tend to seek out care in the emergency room, which obviously puts an additional burden, not just financially on the hospital, but in terms of manpower and staffing as well. My takeaway would be that the expiration of these tax credits is going to have, I'll say, my one big takeaway from this evening is that the expiration of the enhanced premium tax credits is going to put a lot of people in really difficult financial positions, not just in Juneau, but in Alaska and nationwide as well. And that's going to lead to a whole host of economic effects. I discussed the effects on the local healthcare system, but the effects on having a less healthy workforce, for example, putting a greater strain on social services, and also just having that increased economic burden creates less disposable income for individuals to actually participate in the economy. So you see less spending and less new business formation. Having the Affordable Care Act tax credits is huge for people that are entrepreneurs and don't otherwise have access to employer-based healthcare. So we see, with the expansion of the enhanced premium tax credits in 2021, we saw a big increase in entrepreneurship indicators, new business formations, et cetera, because it really frees up people to afford their own healthcare while not necessarily depending on their employment.